What if your OR could transform fat not just into volume, but into true, powerful, regenerative power in just 15 minutes, consistently, in a systemic manner for every patient? Today, I have the pleasure to be with Dr. Derek Banyard, the founder of Sayenza. Dr. Derek Banyard, can you tell us more why you created Sayenza?
Absolutely. So at Sayenza, we believe that fat is the future. And we are addressing the most overlooked component in regenerative fat grafting, which is standardization. Traditional fat processing is impacted by both the variability in the human condition, but surgeon experience. And we remove that variable by introducing automation and precision to every regenerative fat grafting procedure.
Very interesting. So instead of artistic ways of processing fat, you created one reproducible, safe, and efficient process for every patient, right?
That's 100% correct.
So versatility is a big thing for your technology. Can you tell us more how your technology can deliver on traditional fat transfer versus nanofat applications?
So fat is the largest reservoir of adult stem cells in the body, but it's also the body's substrate for all things volume. And that's why liposuction is the #1 procedure performed by plastic surgeons, because not only are they using that fat for fat grafting, but they are also repurposing it for regenerative applications like intradermal skin improvement. Our device can do both seamlessly and at the point of care.
Very interesting. So fat isn't just a filler anymore. It's liquid gold improving quality of tissue. So time is money. Plastic surgeons hate time-consuming prep. How does Sayenza help gain efficiency in the OR?
That's right. So for your typical procedure, a surgeon might take anywhere upwards of 30 to 60 minutes to process fat. They're doing fat washing, followed by mechanical processing, followed by filtration, all while the patient's under anesthesia. Our device can cut that time in half, if not fourfold. And this means safer surgeries for the patient because they are under less anesthesia, which means a lower risk profile. But it also means more time for the surgeons to do additional procedures.
So faster preparation, shorter anesthesia, safer for the patient, more procedures per day for the surgeon. It is a win-win for the surgeon, more profit for the patient, more safety. Very interesting combination. Safety is always top of mind when we talk about surgical innovations. So can you explain why this automation could improve safety for the patients?
Automation is definitely #1, but I also want to posit that it's a closed system. So if you look at most fat processing systems, they require the transfer of the fat from a syringe to tubing to another device and back to a syringe. Our device is a closed system, which removes that contamination risk. But the automation element removes the human variability. But importantly, it results in a faster procedure, which means less anesthesia time and a safer procedure for the patient.
So for investors watching, what makes the Sayenza value proposition so compelling?
I think it's a combination of clinical impact, broad use cases, and scalability. From a fat grafting standpoint, we're building the only device that can process as little as 50 cc's of fat, but upwards of 2 liters of fat, depending on the application. And on the regenerative side, we are creating therapeutics that have 4 times the enrichment of critical stem cell populations that have implications not only in orthopedics and orthobiologics, but also wound healing and other regenerative medicine procedures that we haven't even thought of.
So versatility, efficiency, safety, winning combination. Congratulations. It sounds like the future of fat grafting is not just about volume, filler, fat. It's about elevating biology in a predictable and fast and safe fashion. Dr. Banyard, I want to congratulate you on the behalf of IMCAS for your selection for the IMCAS Innovation Tank.
Thank you.